What's going on, everybody? Dr. Nathan Thompson here, author of Transformation 28 and creator of the T28 Challenge and clinic director here at Exemplify Health Center. And today I want to talk to you about cholesterol and why cholesterol has become medicine's biggest scapegoat. Now, before I go over with you the facts about cholesterol, I want to tell you a story that's going to put everything into context. And this is the story of the Christmas ham. And I talk about this in the book Transformation 28. But the story about the Christmas ham goes like this. So a young girl was watching her mom prepare the Christmas ham, and right before she puts it in the oven, the mom cuts the ends off of the Christmas ham. And the daughter says, "Mom, I don't understand why you cut the ends off the Christmas ham. Why are you doing that?" And the mom thought for a second, and she said, "You know what? I don't know. Grandma always did it." So then Grandma comes into the kitchen, and the daughter asks, "Grandma, why did you cut the ends off of the Christmas ham?" And the grandma thought for a little bit, and she said, "You know what? I don't really know either. It's just what great grandma always did." So then the daughter and the mother and the grandmother all went into the living room where great grandma was sitting there watching television, and they all asked great grandma, "Why did you cut the ends off of the Christmas ham?" And great grandma said, "Well, that was easy. When I was your age, I didn't have an oven that was big enough for the Christmas ham, so I had to cut the ends off so that it would fit into the oven." So the reality is the reason why I always tell this story is because we do so many things in healthcare because it's something that we've always done, or maybe it's just what my doctor told me. Now remember, when I go over this research, when it comes to cholesterol, this is going to come directly from the horse's mouth. This is not my opinion. The reality is this: in healthcare, is we're doing a lot of things that don't make sense. And the saying goes that if you tell a lie big enough and you keep repeating it, people will eventually come to believe that lie. And let me give you something to back this up. So Duke University just recently was forced to pay a $112 million settlement on a lawsuit for actually falsifying study data. And the reason why this is so huge is because Duke University is a prestigious study that a lot of research actually goes through, yet now they've actually have been found, one of the largest research universities have been found to actually falsify data in order to fit their narrative. And not only that, recent news too, Johnson & Johnson and Bayer have now agreed to settle a lawsuit regarding the drug Xarelto for $775 million. Now, this Xarelto was a popular anticoagulant drug. You probably have seen it advertised on the commercials. Well, the reason why they paid a $775 million lawsuit because of the deaths that it caused because of an increase in internal bleeding. That's totally okay, though, according to the drug companies, because they have actually made $2.5 billion from the sale of this drug. And people today are dying, and it's just the cost of doing business to the drug industry. Now that the American Heart Association says avoid daily aspirin, really is not preventing heart attacks. Yet back in 1988, when they actually looked at the study that was done that made doctors want to prescribe low-dose aspirin to prevent a heart attack, one of the things they actually said was that it did reduce heart attack by 32%, but it actually just meant that out of 100 people that were taking the aspirin, it only prevented one heart attack, which really means that it was actually not lowering your risk of a heart attack by 32%. It means that 100 people needed to be on it to prevent one heart attack, which means the efficacy of it was actually only 1%. And the problem with this was that taking an aspirin every single day actually increased hemorrhagic stroke up to 84%. And so you can see that yesterday's medicine has now become today's folly. And this is certainly true when it comes to cholesterol medication. We're going to go over a couple of questions that we're going to answer. Number one, why is everyone confused about cholesterol? Number two, is cholesterol good or bad? Number three, does cholesterol-lowering drugs really work? Number four, what do your cholesterol numbers actually mean? Number five, what really causes heart disease? And number six, is my testing that my doctor has done in fact complete? So let's talk about cholesterol. Now, this comes directly from the American Heart Association when they're talking about cholesterol. So the first thing that they say is that cholesterol is a waxy substance that comes from two sources. It comes from your body and it comes from food. And your body, especially your liver, makes all the cholesterol you need and it circulates it through the blood. So what they're actually saying is cholesterol is absolutely needed in order for your body to heal. It comes from food and it's also made in the liver. Now the interesting thing is that when people say you need a low cholesterol diet, only 10% of your cholesterol actually comes from food and the other 90% is actually produced in the liver. Now furthermore, what they also say is they say it may surprise you to know that cholesterol itself isn't bad. So pay attention to that cholesterol itself isn't bad. In fact, cholesterol is just one of the many substances created and used by our bodies to keep us healthy. So cholesterol is not in and of itself bad, according to the American Heart Association, and we need it in order to stay healthy. Here's why we need cholesterol. So number one, cholesterol makes up the cell membrane inside of our cells. Now we have about approximately 73 trillion cells inside of our body, and the cell membrane is what scientists now call the brain of the cell. It's not the DNA, it's the cell membrane, because the cell membrane is what is responsible for what goes in the cell and what goes out of the cell. So it's kind of the gatekeeper that allows the good stuff to go in and the bad stuff to go out. Number two, cholesterol is responsible for brain function and memory. Now, our brains actually only make up about 2% of our body mass, but 20% of our cholesterol is actually located in the brain. So protection of the brain is what cholesterol does as you get older and have more exposures to toxins. So in reality, cholesterol should naturally go up as you get older to provide protection of the brain. Number three, cholesterol is needed for brain development. This is why breast milk is very high in cholesterol. They've actually have found that kids who have been breastfed have a higher IQs. They have a higher amount of brain development. This is also why formula doesn't have any cholesterol in it, because they're still scared that cholesterol will cause heart disease. More about that in a minute. Now, cholesterol is also needed for nerve function, which cholesterol makes up 20% of what's known as the myelin sheath. The myelin sheath is the outer protection, outer covering of many nerves inside of your body, particularly ones that are carrying what are known as fast action potentials. So myelin is what surrounds nerves like motor nerves. Myelin is actually what surrounds your spinal cord too. If you've ever heard of multiple sclerosis, myelin is what gets damaged by the immune system, and this is why people start to develop a lot of other issues in coordinated movement, because the myelin sheath gets destroyed. Again, cholesterol makes up 20% of that. You also need cholesterol for the synthesis of vitamin D. Now, vitamin D is actually not a vitamin, but more of a hormone. So vitamin D is needed in over 1,500 genetic functions inside of your body, including immunity and including fat loss. Cholesterol is needed for digestion, and the reason why is that cholesterol, as it's recycled, comes back to the liver. Cholesterol is used in the formation of bile salts, and bile salts are what help you to digest fats. Cholesterol is also needed for hormone function, including your steroid hormones. Your steroid hormones include your sex hormones, things like progesterone, your estrogens, your testosterone, and also your stress hormones, which would include cortisol. So you can see here that cholesterol is absolutely needed inside of the body just to be healthy and just to function normally. An article actually that comes from the Journal of Neurology, and they actually found that high total cholesterol levels in late life is actually associated with a reduced risk of dementia. So again, having a higher level of cholesterol as you get older has a protective mechanism against dementia. Now, one of the biggest side effects of cholesterol-lowering drugs, or otherwise known as statins, is in fact dementia. So where did we take a wrong turn when it came to cholesterol and when it came to heart disease? And where it all started was with a man that's known as Ancel Keys. So in the 1950s, there was, the amount of death from coronary heart disease in America was absolutely skyrocketing, particularly in men. And so they wanted to study the role of diet, including cholesterol and calories and fats and carbohydrates and vitamins and minerals, and look at how it influenced heart disease. Now, by the 1960s, there were two theories that were being championed as potential causes. And one theory said that sugars, that excess sugars and carbohydrates were the primary cause. And the other one that was promoted by Ancel Keys was that it was all related to dietary fat and cholesterol. Now, by 1980, they first published their dietary guidelines for Americans, and it focused solely on reducing fat, saturated fat, and reducing your dietary cholesterol for the prevention of heart disease. But it appears that this whole theory of sugars contributing to coronary heart disease was buried. It just went away, and some very powerful influences, namely the sugar industry, didn't want that research actually to come out. And in fact, there was a higher correlation with excess sugar and carbohydrate consumption than there was with, in fact, dietary fat consumption. So this is actually Ancel Keys' research that he did in 1953. It was called the 7-country study. He first theorized that fat was actually the culprit. And so he picked out 7 different countries and looked at their dietary fat and then looked at their prevalence of heart disease. So what you see here is you see Japan had the lowest amount of dietary fat, and they also had the lowest incidence of deaths from coronary heart disease. And so you can see that as the amount of fat went up, fat consumption went up, we saw more heart disease as a result. Now, here's the thing, is that Ancel Keys, he cherry-picked the data, because when you look at more than just 7 countries, one of the things you actually see is you see that, in fact, he only took these countries. But in fact, when you look at these other countries, for example, number 16, which is New Zealand, you can actually see that they have a high amount of dietary fat, but they actually have a lower amount of heart disease. When you look at number 15, the Netherlands, number 17, Norway, number 6, Denmark, number 19, Sweden, you can actually see that all these other countries too have very high amounts of fats that come from their calories, yet you can see they had a significantly, almost a 4-time reduction in heart disease, even though they're consuming the same amount of dietary fat. So what Ancel Keys actually did is that he left out all of the data that didn't fit his narrative, which happens to be a lot of research today. So just remember this, fat is not the enemy. What it can be the enemy is excess dietary sugars and carbohydrates, things like high fructose corn syrup, but also fats that have been damaged or altered. Those are also the enemies. This whole misinformation still continues today. If you've ever heard of coconut oil, they keep coming out with a study that says coconut oil is healthy and that coconut oil is not healthy. Well, the reality is that coconut oil is healthy, and in fact, it doesn't influence anything in regards to heart disease. They actually say that coconut oil increases LDL cholesterol. The reality is we're going to show you that cholesterol is not the indicator for heart disease. And we're going to show you what the true indicators for heart disease actually is. Fat, again, is never bad unless it's been altered. So again, hydrogenated, partially hydrogenated oils, rancid vegetable oils, those are the things that have been altered that are damaging inside of the body that actually causes the true reason why heart disease actually exists. Let me show you this whole level of thinking when it comes to doctors actually saying that cholesterol causes heart disease. How they came up with this conclusion was this. A person had a heart attack, and a doctor saw fatty deposits that were made of cholesterol in the arteries around the heart. Number 3, the doctor concludes that cholesterol causes heart disease. And then number 4, the doctor prescribes a cholesterol-lowering drug, thinking that if you lower cholesterol, you're going to lower the amount of heart disease. The problem with that is this is the same level of thinking. So with this level of thinking, I could also conclude that a person has a car accident. Number 2, the accident investigator sees skid marks at the scene of the accident. And number 3, an investigator concludes that skid marks are in fact causing car accidents. And then number 4, the investigator prescribes non-stick roads. See, just because you see skid marks at the accident doesn't mean that the skid marks actually caused the accident. And just because you see a buildup of cholesterol in the arteries with a heart attack doesn't mean that the cholesterol is in fact causing the heart disease. And in fact, the cholesterol is actually there to protect, to heal, and to repair. Does cholesterol actually cause early death? So high cholesterol, early death. Well, there's a lot of studies out there, and I want to show you just one. This was a 2001 study called the Honolulu Heart Program. And in this study, they followed 3,500 people for 20 years. So this was actually a long study. What they found from it was that there was an increased mortality in those who actually had low cholesterol levels, and long-term low cholesterol levels actually increased the risk of death. So what they found is that you didn't live as long when you had low cholesterol. And here was their interpretation. We have been unable to explain our results. These data cast doubt on the scientific justification for lower cholesterol in elderly people. And the reason why they were unable to explain the results was because they automatically assumed that high cholesterol was the reason why people died early from stroke or from heart disease. So this study here actually blows this low cholesterol equals health equals no heart disease myth out of the water. So what about these statin drugs? Do these statin drugs, in fact, even though they lower cholesterol, do they do their intended function? The reason why people take cholesterol-lowering medication or statin drugs is not to lower their cholesterol. Ultimately, they want to take it to prevent a heart attack or to die from a stroke or heart disease. So do the statins actually really work? Well, this actually came out of Business Week back in 2008. And in Business Week, they looked back at all of the research and looked at all of the data to see, in fact, if these drugs were performing their intended function. So here's what they said. Number one, 0%. So 0%, it did not prevent heart attacks or death in people over 65, in women whatsoever, and saw a 0% reduction in total deaths. Number two, they said statin drugs did in fact help prevent a heart attack or stroke, but in order to prevent a heart attack or stroke, depending on the demographic or the group of people, men or women, or their age category, they actually found that between 70 to 250 people needed to be on this drug for an extended amount of time in order to prevent just one heart attack or stroke. So let's say that it was 100 people. 100 people needed to be on this medication in order to prevent a heart attack or stroke. The reality, what this means is it means that in order to benefit one person, 100 people need to be taking the medication. And to prevent one death from a heart attack or stroke, over 500 people needed to be on that medication. Now let's think about this just for a second. If I actually said that I have a cure for X disease, and you have a 1% chance of being cured from this disease under my care, chances are people aren't going to be very excited about undergoing my care. And furthermore, if I said there's numerous side effects to being on this specific cure, and about 25% of you are going to have some pretty severe side effects. So it begs the question, why are these drugs still prescribed? And the reason why is that because it's called the standard of care. So statin drugs have been written into the standard of care for medical doctors, which means that if doctors don't follow the standard of care and something happens, then the people come back and sue them for a breach in the standard of care. So the problem is that doctors now can't even practice medicine based on data. It's the people who are writing the standards of care that are holding them to that standard. So if they deviate from it, you have a heart attack, they can get sued or their license can get lost. And many times doctors will look at the patient and say, you know, these aren't going to help you, but I am obligated for you to write a prescription for a cholesterol lowering drug. Let's look into this a little bit further. If you look at when cholesterol lowering medications started to become popular, it was around the early 2000s. And this is the 2003 Lipitor study. After they completed the study, they came out and they actually said that Lipitor is going to reduce your risk of a heart attack by 36%. Now, everyone said, yes, that sounds amazing. I mean, lower my chance of having a heart attack by 36%. Now, here is the problem with this. If you look at the bottom of this advertising, they actually say this. That means in a large clinical study, 3% of patients taking a sugar pill or a placebo had a heart attack compared to 2% of patients taking Lipitor. So out of 100 people, 3 who were taking the sugar pill had a heart attack, but 2% of patients that were taking Lipitor had a heart attack. The reality is that it's not 36%, it's only a 1% improvement. Anytime a doctor wants to put you on a medication, you don't ask them about the percentage, you ask them what's known as the number needed to treat. So in this case, the number needed to treat in order to prevent one heart attack was actually 100. It means there's a 1% reduction in heart attacks. Now, this actually comes from the horse's mouth. Lipitor has not been shown to prevent heart disease or heart attacks, meaning they don't even understand that why the mechanism of heart attacks or heart disease is, and Lipitor doesn't lower that. This is also coming from the horse's mouth. The makers of Crestor has not been determined to prevent heart disease, heart attacks, or strokes. Now, there are a lot of different side effects being on cholesterol-lowering medication, and I'm going to show you actually why if you understand the physiology of the body. This is really important to understand. When you look at all of your steroid hormones, what you need in order to produce steroid hormones is, in fact, cholesterol. Now, when you look at all of these different conversions, you'll actually see that in order for the body to produce progesterone, and men and women both need progesterone, and progesterone is needed for healthy skin, healthy libido, fertility, women to maintain the pregnancy, particularly in the first 3 months. It's needed for a healthy menstrual cycle. It's also needed for fat loss. If you artificially lower cholesterol, you're going to lower the production of progesterone. But it actually gets worse too, because you also need this for healthy levels of cortisol. Now, cortisol is known as a stress hormone. It's produced by the adrenal glands, but cortisol helps to increase blood sugar during times of stress. During times of stress, cortisol is also anti-inflammatory. During times of stress, cortisol helps to lower the immune system. That's great when a bear is chasing you, not good for long-term adaptation, because long-term adaptation with cortisol means that you're going to deposit more fat, you're going to have blood sugar and insulin control issues. Even being in a high stress state chronically can lead to type 2 diabetes. Now, in addition to that, if you've ever heard of people that are taking corticosteroids, either certain pills or certain injections that they're doing in order to reduce inflammation of a joint, for example, when you think this, do you think that taking these injections or taking pill like hydrocortisone in order to knock out the immune system, do you think it's going to have an effect on cortisol? And do you think it's going to make you put on weight? This is why people put on weight that have been on cortisone for autoimmune conditions or asthma or allergies or things like that. And furthermore, it actually messes up your brain chemistry, because these are all initiated to making these hormones in the hypothalamus and the pituitary gland. Now, just think of this. If this hippo was chasing you, you are going to run and you're going to have a stress response that's going to produce a lot of cortisol, which is great when the hippo is chasing you. But think of this. If the hippo never stops chasing you, or for example, you're under chronic stress at work, with family, financial stress, lack of sleep, too much exercise, all of those things create a higher demand for cortisol. Do you think that the body, because more cortisol is needed, that the body is going to need to produce more cholesterol in order to produce more cortisol? Cholesterol is also needed for the production of testosterone. Now, men and women need testosterone. Testosterone is needed for bone mass. It's needed for muscle formation. If you have low testosterone, you're going to have problems with low sexual desire or impotence. So testosterone is also needed for energy, and it's even needed in order to produce certain estrogens inside of your body. So if you think, I lower cholesterol, do you think it's going to then lower testosterone production inside of the body. Now, right around this time, there was this new male enhancement pill, and it was called Enzyte. And ladies and gentlemen, this is Smiling Bob. And if you're old enough, you probably remember the Smiling Bob commercials. Smiling Bob was not smiling because he didn't lower his cholesterol. Smiling Bob was smiling because he finally could achieve an erection. And for men in particular, when you artificially lower cholesterol, you will lower your testosterone, which will have problems with sexual function, sexual desire, the ability to put on muscle mass, virility, energy. So low testosterone is absolutely epidemic in men today. A lot of times people think that statin drugs are actually lowering cholesterol, when in fact what statin drugs are actually doing is that they're inhibiting liver function. This is the pathway in which the body produces cholesterol inside of your body. So it starts here and then goes through all of these different pathways with all of these needed enzymes in order to finally produce some important things. Cholesterol, but then pay attention to this. This is CoQ10. This is where cholesterol-lowering medication come in, or statin drugs. They come in right here, in which they inhibit this enzyme. So here's the Lipitor, and that is inhibiting this particular enzyme. So when they inhibit this particular enzyme, it's going to automatically block the production of cholesterol from the liver. Now here's what also happens, is that you're going to inhibit and block the production of what's known as coenzyme Q10. Coenzyme Q10 is needed for aerobic energy. And in fact, if you Google the aerobic energy pathway, also known as the Krebs cycle, you'll see that the body needs CoQ10 for all of the cells to produce energy. So why do so many people have issues with things like muscle cramping or joint pain while they're on a cholesterol-lowering drug? Well, you think about it, you inhibit CoQ10, and now the muscles can't fire. And when the muscles can't fire, they go into spasm. But here's interesting. Guess what else is also a muscle? The heart. And the heart also needs CoQ10 in order to beat, which now you could actually assume that a side effect of taking cholesterol-lowering medication without CoQ10 would actually be heart failure. Now, if you are currently on a cholesterol-lowering drug, you absolutely must be on a CoQ10 supplement right now. Listen, this is just basic physiology. You have to at least be on CoQ10 if you're taking any kind of cholesterol-lowering medication. Let's talk about how this affects everything. And if you understand this principle, the Swiss watch principle, this is going to make a lot of sense on how you should actually be looking at heart disease, or any disease for that matter. When you look at the body all works together. No system inside of the body works independently. So the big mover in this whole Swiss watch principle is the nerve system. So again, if we would actually take out one of these gears, it's going to affect how all of the other gears turn and function. So the nerve system, the brain, the spinal cord in relation to the spine, is what is turning the big gear. Now, you can have a spine and a nerve system and a brain that's running really well, but if you start interfering with these other systems are going to be affected as well. So every single system plays a role in the function of all other systems. Let me give you an example. Now, I always ask people, I said, did you know your big toe controls the heart? And everybody laughs and they say, your big toe doesn't control the heart. But let me ask you something. If I smashed your big toe with a hammer, let's see what happens to your heart. Because if I did that, your heart rate would skyrocket. So you think of this, of what healthcare actually looks at. Healthcare only looks at one system. So essentially what we do is we have a general doctor, and then if they can't figure that out, we then go to the heart doctor, or we go to the endocrine doctor. The thing is that that endocrine doctor or that heart doctor starts to reduce things into just one tiny system, and they try to influence just this system only, while they neglect every other system inside of the body. Now I want you to think of this, because this is what I call a specialist. A specialist only works on one system. You understand that a specialist really is someone who knows more and more about less and less until finally they become an expert in nothing. So a true doctor is someone who's going to actually look and see how all of these other systems are working and how they're influencing other systems. And this is what we do, especially being in the wellness way. Essentially, what I am in discovering causes for heart disease is really just a crime scene investigator. My job is to find who is committing the crime. Is it a damaged nerve system that could controlling the heart through its neurology? Is it elevated stress hormones? Is it inflammatory food? And the job is to find out where is the inflammation, where is the stress primarily coming from so that we can fix that so that the body will then start to adapt back into a normal homeostasis. So this is how we actually treat high cholesterol here in the United States. So you have three approaches. The first one is the medical or the allopathic approach. And basically what they do is they treat the symptom of high cholesterol by using drug therapy. They do some very basic lipid testing that's not complete. They give people statin drugs or specific other drugs that are designed to inhibit the production of cholesterol. Now, some people may go as far as going to an alternative medicine approach. Basically, what they do is they still may do basic lipid testing. They may put you on a low cholesterol or no cholesterol diet, and they may prescribe for you fish oils or red yeast rice or niacin in order to treat the cholesterol. So they're still treating the symptom without finding the cause. And we actually call this the Dr. Oz effect. Because how many times does Dr. Oz promote a certain supplement and everyone goes out and buys that supplement because instead of taking a drug, they just want to take a supplement that still covers up the real reason why they have the problem in the first place. Now, our approach is this, is to figure out why is the cholesterol high? Or why are there issues happening inside of the body? And we always test, we never guess. So we take x-rays, cardiometabolic testing, food allergy testing, hormone testing, stool testing, in order to determine where is this stress and where is this inflammation coming from, and how do we start correcting those causes so that the body doesn't adapt by having high cholesterol, which eventually will cause an adaptation of atherosclerosis or an increased plaquing in those arteries. Now, when you look at basic cholesterol testing, this is actually what a lot of people go when they go for their yearly physical. The first one is called total cholesterol. Now, how they come up with total cholesterol is they add very low density lipoproteins. They actually will add low density lipoproteins, and they add what are known as high density lipoproteins. So they add those three numbers together. Now, how they come up with what's known as very low density lipoproteins, or VLDL, is they take your triglycerides and they divide that number by 5. So when they add the triglycerides divided by 5 plus LDL plus HDL, that's how they come up with total cholesterol. Now, your LDL number, so this is known as your low density lipoproteins. Now, the reason why is that in order for cholesterol to be circulated through the blood is that cholesterol has to be carried by a protein. So cholesterol can't be transported in the blood by itself. So it's transported with a protein, and that's called a lipoprotein. So LDL is a protein character that carries cholesterol from the liver to the cells, tissues, and glands of the body. The liver will produce low-density lipoproteins based on this right here, and it's called need. Meaning the liver will always produce exactly how much cholesterol it needs within the body. Meaning if you have very high low-density lipoproteins, it means that the liver is needing to create more cholesterol in order to provide healing and repair to the cells, the tissues, to the blood vessels or glands inside of the body. Remember all of those different functions of cholesterol. Now, HDL, or high-density lipoproteins, is a protein carrier that carries cholesterol from the blood vessels and back to the bloodstream, and it goes back to the liver. So basically, HDL is considered the repair or the cleanup crew. So it's sending cholesterol out to repair, and it's bringing recycled cholesterol back, in order to repair and then get recycled by the liver. Now, triglycerides, this is unused sugar that turns to fat in the bloodstream. And triglycerides actually go up not because of increased fat, triglycerides go up because of an increase in carbs. And in fact, triglycerides, out of all of these four, triglycerides is actually going to be the one that's the most clinically relevant. Basic cholesterol testing. So this is what they're going to be measuring, is basically going to be these four right in through here. Total cholesterol, LDL, HDL, and then triglycerides. So who determines what is normal, what is abnormal? It's actually the drug companies, because a while back, normal was actually 240 or under. If you actually would take a person, so let's say all we saw is we had a camera looking at a weight scale and a person stepped onto the scale, and then they saw that their weight was 375. And let me ask you a question. If someone weighs 375 pounds, is this person overweight? Now, many of you are going to say, yeah, obviously this person's overweight. But what if I said, well, this person is actually 11 feet tall? Then if they're 11 feet tall and 375 pounds, then probably not. This person's not overweight. So this basic testing, when you're looking at total cholesterol, LDL, HDL, and looking at triglycerides, it doesn't give us a clear picture. So let's go over really what the right testing should be. Now, if you're understanding heart disease all starts with inflammation. And I want you to talk about what's known as the vascular endothelium. Now, that's a really big word, but basically every single artery inside of your body has a one cell deep layer around the inside of the artery that's known as the vascular endothelium. So you have this one cell layer thick covering that protects the inside of the blood vessel. This is actually, the vascular endothelium is actually the largest organ inside the body, because if you took out the vascular endothelium, it would cover, in the average person, 6.5 tennis courts. And this comes into a direct point of contact with the blood. And they actually call this vascular endothelium the brain of the artery. So the role of this vascular endothelium, which would be right here, is to act as a barrier, to modulate the immune and the inflammatory responses, to help regulate blood pressure, to help with blood viscosity. And it also produces something really important, and pay attention to this, nitric oxide. And nitric oxide is what helps to keep the arteries open. Now, I want you to think about it. Every time there's inflammation, there has to be an immune response. And the plaquing that you see is actually a result of an immune response. So here you have blood that's going through. This is your vascular endothelium. And what happens is something is creating inflammation inside of the body. Remember, it can be a lot of different things. It can be damaging fats. It can be a high amount of sugar. It can be a high amount of stress. It can be food allergies. It can be due to chronic stress that's taking place on the nerve system. It could be due to toxicity. All of those things produce inflammation. So when you have an inflammatory response, then what happens is you're going to have this immune response, and this immune response is what oxidizes the cholesterol and causes this fatty formation within the artery. Now, where you start running into trouble is when it creates an increase in pressure, and it creates a lot of unsettling around this area. And now you have the potential for this vascular endothelium to actually rupture, which then will activate the clotting mechanism. So when this happens right here, this is what we would know as blocking the blood, and this would be known as a heart attack or a stroke. Now, what's interesting is that a lot of times people will go in for surgery because they say you have a 90% blockage taking place within the arteries. So a lot of people ask, they say, well, how on earth does this blood get through there? It means that everything is getting blocked here. Now listen, if you have a 90% or a 95% blocked artery going to the heart, you would have been dead if it was a 95% blockage. Here's what's really cool about the body, is that once this plaquing actually starts, is that the body recognizes over here that we're starting to lose oxygenation. So what the body does is that it starts to build new capillaries in order to divert blood from here to here in order to be able to feed the organs and tissues. It's called a natural bypass. And this is the reason why when you look at with heart disease and you're looking at bypass surgery, there actually is no evidence that it prevents future heart attacks, number one, but number two, that it actually extends anyone's life. And the reason why is because the body has already made a natural bypass due to the long-term accumulation of plaquing within their arteries. So what causes this inflammation? Well, let's talk about all of these different causes. So you have trauma and inflammation that takes place on the spine and on the nerve system. So you can have neurological trauma that's creating inflammation. Number two, you can have toxins. So things like food allergies, gluten, dairy, increased sugar, bad fats, and even our thoughts, otherwise known as mental stress. And listen, you can take care of these first two, but if you still have a high amount of mental stress, specifically women, you will still stay very sick. So elevated cholesterol is not going to be problematic if inflammation levels are normal. So elevated cholesterol only becomes a problem if there's elevated inflammation inside of the body. Here's trauma. This is why in every single patient in our office, when they're coming in and they're having heart disease, blood pressure, cholesterol issues, every single one of them is analyzed what's happening neurologically and they're adjusted. One of the reasons why is this. From the Journal of American Geriatric Society, they said that a hyperkyphotic posture, which means rounded shoulders and forward head, was specifically associated with an increased rate of death due to atherosclerosis. So normally when you look at someone, the head should be directly over the shoulders, shoulders over the pelvis, and pelvis directly over the feet. Now, if you would look at it on the inside, you actually see that this is the neurology, the brain and the spinal cord. And you can see in this position, no stress or tension taking place in through the spinal cord and the neurological system. When the head goes forward, you can actually see that the spinal cord begins to decay and rot. And in order for you to have any kind of degeneration taking place in the spine, there has to be an inflammatory trigger taking place. And when the spine deteriorates, the spinal cord deteriorates right along with it. Now, one of the reasons why people who are in this posture have an increase in death due to atherosclerosis is because of the sympathetic nerve system. So in your body, you have two divisions of your nerve system. You have the parasympathetic, which is the rest and digest, and the sympathetic nervous system, which is known as fight or flight. Being in this position puts the nerve system in chronic sympathetic tone. So when you have an increase in the sympathetic tone, it puts the body in chronic fight or flight. Now, when this happens in the vascular system, blood will get shunted away from things like your heart, your digestive system, and all of the blood actually goes into the extremities. And as a result, the sympathetic nerve system, in order to shunt that blood away, will decrease the diameter of the vessels in the heart, and over time it will cause inflammation, high blood pressure, and hardening of those arteries. And so this is why having any spinal and neurological stress is so critical to start correcting it. Another one is going to be food allergies and leaky gut. You can actually see in this food allergy test, which is a simple blood test, that this person has an inflammatory reaction to things like beans, cheese, eggs, garlic, cow's milk, goat's milk, mushrooms, oats, canola oil, rice, sesame, soybeans, wheat. Also, this is why you should be gluten-free, and brewer's yeast and baker's yeast. The reason why getting food allergy tested is so important is because your body is actually supposed to absorb amino acids, not proteins. And amino acids basically are proteins that have been properly broken down in the stomach. And this is why you'll see that a lot of people who have heart disease also have problems with reflux. Because again, they don't break down their food. And so as a result, a lot of these proteins, because they're not broken down, end up going into the blood, which produces an immune system reaction and inflammation. If you think about it, how many people are taking antacids and proton pump inhibitors like the purple pill? And then when we test these people for food allergies, they have a ton of food allergies that then just creates more and more inflammation. Now, the other test too, looking for toxicity would be cardiometabolic testing. Cardiometabolic testing is not just looking at, for example, your cholesterol, but it's also measuring all of these different areas. And I'm going to go over the three big ones. But it's also measuring things like insulin, A1C, blood sugar, because there's a high correlation with type 2 diabetes and heart disease. And the reason why is because a high sugar diet leads to type 2 diabetes, but it also creates inflammation leading to heart disease too. Here's the first one we have to look at. So this is actually going to tell you a lot more than just looking at your total cholesterol. This is actually looking at cholesterol particle size. Now, cholesterol particle size makes a big difference. So I want you to think of if you had a tennis net here. So a tennis net is designed to prevent a tennis ball from getting through. So if you hit the ball against a tennis net with a tennis ball, it's going to get caught. But if you hit a golf ball through a tennis net, it most likely is going to go through. The reason why this is important is because, remember, cholesterol is there to heal and repair. However, the smaller the particle size, the more likely this low density, small particle cholesterol is likely to squeeze under, remember, that vascular endothelium and create an inflammatory response. So particle size is more important than total cholesterol. The next test is to look at what's known as CRP, or C-reactive protein. So C-reactive protein measures inflammation. Now, C-reactive protein, and is present when there's inflammation. So a C-reactive protein test can be used to evaluate your risk of developing coronary heart disease. So remember, the arteries don't become narrowed and they don't plaque unless there is, first and foremost, the presence of high amounts of inflammation inside your body. So measuring C-reactive protein is more important. The third thing is going to be measuring homocysteine. So homocysteine is also another inflammatory marker. So high levels of homocysteine are related to the early development of heart and blood vessel disease. And in fact, an elevated level is considered an independent risk factor for heart disease. So always measuring inflammation by measuring homocysteine, measuring C-reactive protein, and also measuring cholesterol particle size. So again, always get tested. You want to test the nerve system. You want to see if you have excessive forward head posture. You want to make sure that you are getting an X-ray on that. Number two, you want to be addressing things like food allergies and digestion. You want to make sure there's no inflammation that's happening in the gastrointestinal system. You also want to look at your inflammatory markers inside of the body. And when you start addressing those things and you start getting to the real reason why there's inflammation inside of the body, then essentially you don't have to worry about cholesterol, because cholesterol is not the bad guy, inflammation is. So guys, I hope you enjoyed this about cholesterol. If you have a question or comment, leave it below. Pass this on to other people who are taking a statin drug and tell them it's not lowering their risk of heart attack and stroke, and yet it's actually making you much, much sicker.